Welcome back to Island Life Stories, the podcast where we sit down with remarkable people and explore the journeys, challenges, and turning points that have shaped who they are today. I'm Darren, and today's episode is one that I genuinely believe will resonate with so many of you. Whether you've had a health scare, felt burnt out, or simply know that you've been putting yourself at the bottom of the priority list for far too long. My guest today is Dr Anne Alison, an NHS GP with over 25 years of experience, a mum, a runner, and the founder of Vale Wellness, a holistic private clinic in Cowbridge, South Wales. But what makes Anne's story truly extraordinary is what happened to her during COVID. Because this doctor, who has spent her whole career looking after other people, found herself on the other side of the consultation table, facing a breast cancer diagnosis. What she did next, how she used that experience to completely reset her life, retrain in lifestyle medicine, and build something that could help others do the same, is nothing short of inspiring. So sit back, have a listen, and get ready to think differently about your health, your habits, and what it really means to look after yourself. This is Dr Anne Alison. Hi, Dr Alison. Thank you very much for joining us on Island Life Stories.
Hi.
Your story, I think, is very inspirational. I think it's going to resonate with a lot of people listening to this, and I can't wait to get into it. Obviously, it revolves around diagnosis.
Mhm.
I thought let's talk about Dr Anne Alison pre-diagnosis. What
Sure.
was like before everything changed for you?
Okay, life was a bit crazy, a bit busy. As you've got kids, you understand how it's difficult to manage your sort of life and work balance. And I must admit, I never did it particularly well. So first of all, I meant to say thank you for having me on. It's so lovely. It's really lovely to see you. And I think you don't mind me saying that I know you because I have looked after you and your family, been your GPs, and also helped with getting you out there to St Helena with your assessments and medical things and stuff like that. So yes, I've known you for a little while now. So thank you for having me on. It's lovely to talk to you and to catch up. But yeah, so I'm an NHS GP. So I qualified a long time ago now. I've been a GP for about 25 years. I work in Cowbridge, a small village in South Wales. And before COVID, I think I just ticked along quite nicely, like so many healthcare professionals did. We went into work, we looked after our patients, we went home. COVID hit, and of course, life changed quite dramatically for everybody, didn't it? In many different ways. And I think the health service, as I'm sure everybody knows, struggled massively when it came to COVID. And during that time, we weren't really able to reevaluate anything because we were just so busy hoping and trying to look after people and make sure everyone was okay, that it wasn't a particularly pleasant time, but for anybody, for doctors or for patients. And then I think after COVID seemed to settle down, the health service has just been so battered that I don't think it can really cope with what we're dealing with at the moment. So it's sort of very unsatisfying situation at the moment. Working as an NHS doctor, I know a lot of our patients are not happy with the service they're getting from us, even though we're absolutely trying our best. And I'd like to say that we're actually not happy with the service we're giving either. It's life's difficult at the moment in the NHS. But yeah, so I am an NHS GP, as I said, have been for a while, and I'm also a mum of two children. And I'm also somebody who likes to go running. I'm somebody who owns a restaurant, so does a bit of baking for a restaurant as well. So I think you'd probably call me a portfolio GP in the fact that I do a lot of different things, which is probably keeps my mind sane, to be perfectly honest.
Oh, yeah, I didn't realize you were part of a restaurant. Amazing.
Yeah, so I do the baking. I do some of the desserts for the
Cool.
restaurant. So that's my Friday job where I just, sit overlooking the sea, baking cakes. It's great. I love it. Yeah,
Yeah.
yeah.
So COVID hit, but that I don't know for people I've already spoken to, COVID was in itself pretty much a turning point in their lives.
Absolutely. Yeah.
It gave everybody a chance, I think, to stop and look and think about their direction and where they are and where they're going, isn't it, really?
Yeah.
It was more obviously from an NHS side of it, a work side of it.
Yeah.
It threw everything up in the air
Yeah.
work-wise, and it was just a different place to work. Coming out the other side
Totally.
of it, wasn't it? Yeah.
Yeah, absolutely. The waiting times have extended massively, and we had to learn as GPs to deal with a lot of things that we'd normally just send into hospital because we couldn't send into hospital, and the waiting times were so long that we had to deal with a lot more technical and difficult cases. But you learn, don't you? And this is what we do in medicine. We're all adaptable as humans. But yeah, it wasn't a particularly pleasant time to work, and particularly with just everyone got so poorly, and of course all of the post-COVID residual sort of problems that we've seen as well, the long COVID issues. People have had blood clots in different places. There are lots of different things, but
Mental health.
yeah,
Yeah.
yeah. Yeah, absolutely. Yeah, we're just talking about the physical there, but the mental health, absolutely, that's been huge. And particularly when you look at perhaps the kids who have been in school or not schooled, homeschooled during that time, not had that normal sort of social education and environment. It was difficult. But during COVID, I identified a breast lump. And being a doctor, I'll be totally honest, Darren, I examined myself and thought, oh, it's fine, it'll be fine, it's nothing, it'll be okay. Booked an appointment eventually to go and see someone because I needed a specialist opinion, and almost didn't go to that appointment because I was so busy that day. I was in a clinic and I was overrunning with my clinic. One of my colleagues took one of my patients, which was really kind of them, and I just thought, oh, do you know what? I'll make another appointment. I won't go. And fortunately, did go. My colleague said, no, you've got to go. You've got the appointment. Just get going. I'll look after your patients. And yeah, went into a breast assessment, and bless her, my consultant was somebody I knew already. And I think it's always difficult sometimes to treat fellow doctors because I don't know, it's just hard. It's easier in many ways because you speak the same language, but it's difficult as a doctor to be a patient, and it's difficult as a doctor to look after a doctor sometimes. So I had all the tests. I had mammograms and ultrasound and biopsies, and I said to her, I said, if I was a betting lady, are you betting that it's cancer or not? Because she didn't really want to say. And she said, yeah, I think it probably is. And I got a diagnosis of breast cancer. And that was during COVID. So it was when you had to go into hospital on your own. You still had masks on. You didn't have anybody with you. So yeah, it was an interesting experience then being the patient rather than the doctor. And not one that I particularly enjoy, I'll be entirely honest, but it has taught me a lot. So I think you've always got to take the positives out of the situation, haven't you? So, yeah.
Even though you're a GP, I'd imagine just taking that information in is still quite difficult, isn't it?
Yeah.
It's quite hard. It's not
Yeah.
something that anybody can prepare for, really, I don't think, is it?
No, and I think the first couple of weeks, as you wait for your biopsy results, which obviously will give you more information, you have more scans, MRIs, all of those sorts of investigations. And no matter who you are, and no matter who you see, and no matter what pressure you put on the service, these things don't get done quickly. It still takes a couple of weeks to get any form of official diagnosis, and until you've got that diagnosis, you can't make a plan. You can't work out what's going to happen in terms of treatment. So you've got that horrible 2 weeks in limbo where it's just not pleasant. Everything goes through your mind in terms of, God, what could it be? You always think about a worst case scenario. I think it's human nature, isn't it, really, to think that way. And I was then really lucky in that, it seems a silly thing to say, but if you have to have a form of breast cancer, I had probably the nicest and easiest of all to manage. So I didn't have any metastatic spread. It was literally just within the breast tissue itself, which was great. So I didn't need any chemotherapy. I just had the cancer removed and then had a course of radiotherapy. And then that was pretty much it. I remember going into my oncology appointments and they were wonderful. They were lovely. But I walked in and they went, oh, why are you here? I was like, oh, okay. Yeah, my name's Anne. I've got breast. They're like, yeah, we know all of that, but actually, you don't need to be here. You're fine. You just get going. Just carry on and do stuff. And I remember thinking, oh, okay. And it was great. Don't get me wrong. That was the best
Yeah.
thing I could possibly hear. And it was, of course, it was still during COVID. So, you literally couldn't talk to anybody. You were sat on your own in a waiting room full of other people that had been diagnosed with cancer. I left. I didn't have anyone with me because you didn't, because it was COVID. And I just left thinking, oh, okay. It was the strangest experience. It was wonderful, don't get me wrong.
Yeah.
I was so happy to have that sort of diagnosis, which meant that the treatment, fortunately, touch wood, I'm 4 years post now and has been successful. There's no recurrence. I keep having annual checkups. Everything seems to be fine, touch wood, fingers crossed. But yeah, just a really odd experience. It feels like almost feels like it happened to somebody else now. It's really strange. But it caused a lot of, no, it didn't cause a lot of issues, but it made me think a lot about where I was and what was going on in my life and how I was looking after myself or not looking after myself, and what I needed to do in the future in order to stay alive, but also to be able to carry on living.
Yeah, I think what you said a bit earlier as well hits home a bit. That
Yeah.
the GP can have the same sort of attitude as probably most of us would have, in that, well, it's only a lump. I'll just ignore it.
Yeah.
It's nothing to
Yeah.
worry about. I've got loads of stuff. I haven't got time to
Yeah.
look at it or do anything. I'll put it on the back burner as my list to do. I think,
Exactly.
and that's probably not the advice you'd give a patient yourself, but you acted probably exactly like a patient would react. Really,
Uh-huh.
would you? Just
Yeah, yeah, this is it. I wasn't a doctor at that point. I was a patient.
oh,
And if I'd been a doctor, I would have really said, come on now, given
yes,
myself a strict talking to and booked that appointment. But yeah, so I think a diagnosis like this is really useful for me as a doctor because it means that I can then, I don't know, you just have so much more understanding into the psyche. You just experienced something, you've experienced being a patient. And
yeah,
as a doctor, we don't often do that. We're useless patients. We're really bad patients. We do everything we can to avoid being a patient. I've got one good friend who's an ENT consultant who works with me in the clinic. And I introduced myself to him a couple of years ago. Our kids are friends. And he said, yeah, you won't know me because I've never been in to see the doctor. And I was like, yeah, he's a male consultant surgeon. He's never going to come and see me at all. Even if his leg's falling off, he'll, work something else out.
brilliant. Obviously, coming out of COVID and coming out of that diagnosis, you've had to stop and think and decide, right, I need to change
Yeah.
things.
Yeah, absolutely. I think a few different things happened. The health service, as we've talked about before, just wasn't coping before COVID and has just unfortunately is now coping less and less. And I think I was very much of the opinion, I was always, as a youngster, I was always really sporty and into sort of looking after myself and being healthy. And then you get a bit older, you go to uni, as we've talked about before, the first year of uni is all about learning who you are and going out and enjoying yourself and perhaps testing your alcohol tolerance, perhaps, and those sorts of things. Medical school's 5 years, obviously. You do your medical school. You then do the most ridiculous thing where you go and become, it's a little bit different now, actually, fortunately. You'll be pleased to hear. But you go and become, back in my day, we were house officers. And you would work like 120-hour weeks. You'd do sessions where you'd start on call on a Friday morning and you wouldn't finish until a Monday evening and you wouldn't sleep during that time. And you just think, oh my God, in terms of looking after patients, they've now realised that perhaps isn't the best idea is to have a doctor looking after you who's not slept in 3 days. So that's great. But at the time, that's just what we did. And we worked really hard. We played a bit too hard as well. So all of that sort of stuff, that's what we did. So didn't look after myself at that point. Then, of course, you get qualified, you then have a family, you then stay up all night looking after your kids, you run around like a taxi service, all of that. So I know you totally appreciate this, but you just don't look after yourself, do you? And nobody does. And it's really not good.
You put yourself further down the pecking order. Everyone else's priority above
Yeah.
yourself. And it
Yeah.
shouldn't be like that, because if you stop functioning, then everything else.
Absolutely right. Everything else falls apart, doesn't it? Yeah, no, you're absolutely right. But I think what I realised is that when I then was able to take stock, when I had the diagnosis, I was really fortunate in that I took a few months off work, and during that time, I looked at why I had the cancer, and I've got no family history of anything like that. I'm a fit, healthy young woman. I eat reasonably healthy. I don't drink a great deal. I don't smoke. I exercise regularly. So in theory, there wasn't any reason why I should have had breast cancer, but did, obviously. And I think I looked at it and thought, actually, when I really critique my life, I've been working stupid hours. I don't sleep particularly well because you're constantly thinking. You'd laugh at this, Darren. I quite often wake up in the morning and I've been thinking about a patient overnight while I've been asleep in my subconscious brain. And I'll wake up and I'll go, oh, that's the diagnosis. Brilliant. I'm going to give them a ring. Let's try this treatment. But I suppose correspondingly, your brain doesn't switch off very often, and it should do. So, yeah, I think all of these things.
Give yourself any downtime, and it's not through any fault of your own. It's just you're not able to.
It's just a busy life, isn't it? Everyone's busy. We're all really busy doing stuff, but I think we all need to be looking after ourselves. And I think having a diagnosis of cancer, which does make you question your mortality, you do think, God, you know what? I am going to die at some point. Whereas when you're younger, you don't think you're ever going to die. And I think I felt quite let down by my body. And I think that's quite an interesting point in the fact that I just thought, why is my body not getting rid of this cancer? Why have I become somebody that has been diagnosed with cancer and had to have treatment for it? But then when I really looked back, looking at my lifestyle, I thought, well, actually, it's obvious why or I can explain why I might have developed cancer, because I wasn't sleeping properly. My diet wasn't particularly great because I was eating ultra processed food and I wasn't probably having enough fruit and vegetables, and I wasn't getting that. I wasn't meditating. I wasn't getting my brain calm. All of those things are all risk factors for cancer. So I think that's my thoughts as to why I probably developed cancer. But it was good to be able to identify perhaps reasons why, because then I could do something about it.
Yeah.
And I then went on to think, what can I do about this? And I decided to do a diploma in lifestyle medicine. So that's very much is what it says on the tin. It's looking at aspects of lifestyle and how your health can improve. And I think we're realizing now that actually there is so much to our lifestyle that can affect our health, negatively affect, but also positively affect our health. And it's all the basic stuff, Darren. It's just, as we just said, it's making sure you're getting enough restful sleep that's actually going to help your body repair and recover. It's not putting poison in your body. So, not drinking too much alcohol, drugs, ultra processed food, all of that horrible stuff. It's making sure you're getting good nutrition, good nourishment, so that your body can fight these illnesses off. It's making sure that you exercise on a regular basis, good social connections, good mental health, all of these things. It's not rocket science. And in fact, it's what all of our predecessors did years and years ago, but we've almost lost a bit of that, really. So me having that diagnosis gave me that downtime. I had a few months where I literally just focused on my lifestyle. I was walking 20 miles a day at one point. My poor dog, she lost so much weight. Her paws were raw. But just had a really good reset. And at that point thought, do you know what? I need to do something about my life. I need to change things dramatically. And not only do I need to change things dramatically, but with that information that I have, I want to really be able to empower other people to do the same thing as well. Because we just don't do it. And we all know that we should look after ourselves. But there is really good scientific evidence that will give you that push, that reasoning as to why we should be looking after ourselves from a lifestyle point of view.
Yeah, I completely agree. And what we touched on earlier, it's so easy to forget to look after yourself.
It is.
Like I said, put yourself down the pecking order
Mm-hmm.
in terms of priority, and not giving yourself any time or attention that you need, really, not even deserve it, you need.
Yeah.
And I know, both mentally and physically, it's like looking after a garden. You've got to do a little bit every day
Yes.
to maintain it and to make
Yes.
sure your mental health is good and your physical health is in a good place.
Yeah.
Small steps, little
Yeah.
and often.
Yeah. Absolutely right.
If you don't do that, then things can start sliding, and it's a difficult thing to get back up from as well, isn't it?
Yeah.
And unfortunately, and I think that again, your story will resonate with a lot of people. It takes something like that's happened to you for you to stop and to realize what's been going on, what's happened.
Yeah, yeah, absolutely right. And I wouldn't wish cancer diagnosis on anyone or a serious illness on anyone or any form of negative life event. But for me personally, it has really made a massive difference in that I'm always somebody that thinks there's always a positive to every sort of situation. There is always something positive that you can take out of something negative that's happened to you. And yes, I had breast cancer. It was pretty grotty. But actually, my life has changed dramatically since then, and it's all for the better. It was if you can say it, it was a positive thing to happen. Strange to say, isn't it? But yeah, that's how I feel.
So, and you just touched on it there before I interrupted, but you basically decided, I've helped myself. I know what I need to change myself. I want to take other people with me. I want to help other
Yeah,
people as well. So,
absolutely.
did that then just lead directly into the Vale Clinic? Or,
Yeah, absolutely. So I think it's very difficult to not be a firefighter within the NHS. You literally, it's very much just right. Well, that's a symptom that you've got. That's a problem. There's the medicine. Off you go. Good luck. And I just felt there was so much more to medicine than that, and so much more to patient care. And actually, the health service at the moment is about to fall off a cliff, and we can't. I don't know how we're going to save it, but certainly what we do need to do is we need to prevent that illness from happening in the first place. Prevention is always better than cure. So I then opened up Vale Wellness, my private clinics. Again, started off as a little. Oh, you honestly, you would have laughed. You know, my practice manager Jo, who was
yes,
literally my right hand woman, could.
absolutely. Yeah.
She's incredible. I could not do it without her. But I met her a few years previously, and we just kept in touch. And I went into her back garden one day in the summer, and I just said, "Oh, Jo, I'm going to open up just a little private GP clinic. Just I'll maybe do a couple of hours a week. Can you give me a hand? Just doing maybe answering the phone, typing a few letters." And that's how Vale Wellness was born. And of course, as you know, it's now a three-story building in the middle of Cowbridge. We're private GP. But we've got a real holistic touch to it. So we've got physiotherapy, reflexology. We've got facials and massages because they're obviously great for life. We've got podiatry. We've got lots of other different specialties. We've got a consultant psychiatrist who comes in and does breath work and meditation with us. We've got Pilates. And we've got lots of consultants that come in and do clinics as well. So typical medicine, so cardiology clinics, ADHD clinics, respiratory clinics, dermatology, all of those sorts of things. But yeah, I wanted to be able to, I was getting increasingly frustrated with the NHS in the fact that we were literally just the tip of the iceberg, firefighting. And also, our hands are a little bit tied in the NHS. I don't know whether people realise, but we are only allowed to prescribe certain things. We need to act within certain guidelines and certain protocols, which the vast majority of the time are very useful. But sometimes it's not in the best interest of the patient to act in that way. And I think protocols are formulated by looking at lots of studies of middle-aged white men, and right, this will work for them, but that doesn't mean it's going to work for a perimenopausal woman with crazy hormones going on. And the same thing that works for a white middle-aged man isn't going to work for them. So I was getting frustrated with not being able to do a sort of tailored, individualized, bespoke healthcare for somebody when I knew perhaps that what we do in the NHS wouldn't be the best thing for them, but it would be the only thing we could do for them. So opening up a holistic medical wellness clinic just gave me that opportunity to be able to practice in a way that I thought was better for the patient. So it's been lovely to have that sort of space to be able to do it. And it's a private clinic, obviously, which means patients have to pay to see me and to access the services that we provide. But we do lots of other sort of stuff like educational events, which are free. We do educational walks. So really, really keen to be able to educate people and be able to pass on everything that I've learned that I have found so useful in terms of everything, in terms of general health, in terms of cancer prevention, in terms of keeping your mental health strong, but giving that back to individuals, being able to share that information, which is why something like this is so useful, to be able to talk to people via a podcast perhaps and be able to share information that way.
Absolutely, yeah. And I think I love what you've done with the clinic, and I think it's just so accessible where it is as well. You're not having to go to like an industrial park, far end of Cardiff or something like that, to
Yeah,
out of your way to do something like that. This is something in the high street.
yeah.
It can become part of, and it probably is part of a lot of people's daily lives or
Mm,
weekly routine.
mm,
But I think also as well, it dovetails with the NHS as well. The NHS obviously is desperately need that for many things. But
yeah,
if somebody has an option to go somewhere like the Vale Clinic, where
yeah.
they can access things a lot more quickly, well,
Mm,
obviously paying for it, and the fact is it's expanding all the time as well with all these
yeah,
different options. It's just outstanding. Love it.
yeah.
Love it. The
Ah,
service is amazing, I got to say.
Thank you very much. I've got a most incredible team there. I've been really lucky, actually, in the fact that I've mostly employed friends and people that I know, and particularly consultants that I've respected and know are excellent. All consultants are really good, but particularly friends of mine. And the team I've got there now are so passionate, and they're so passionate and so caring regarding patient care, but we're all singing from the same hymn sheet in the fact that all we want to do is look after patients. All we want to do is to try and keep people healthy. And we've had some spectacular results from people who, I've got one lady, and she just resonates with me so well. And I'm sure she will with some of your listeners, but she's a lady who, she's a teacher. I know you know a teacher well. She's a teacher, and she was just generally struggling with everything. So she was overweight, her cholesterol was high, family histories and problems like that. She suffered from really nasty migraines that were quite problematic for her. And she wasn't really exercising a great deal, two young children, wasn't getting on well in work particularly, or finding it a struggle, sorry, more than not getting on, just finding life a struggle in general. And she's come to the clinic, and we've done lots of different things with her. We've approached her health from lots of different angles, including things like reflexology and massage and things like that. And we've just had a new medical device come into the clinic, which is an autonomic nervous system regulator. I know, it's mind-blowing.
Oh, I know.
Can I tell you a little bit about it? Yeah,
Yeah.
you've read all the science behind it, haven't you?
Yeah,
You know. Can I tell you a bit about
yeah.
it, Darren?
Yes,
Yeah.
please. Yeah.
Oh, brilliant. So it's called a NESA device, and it's a Spanish device, and actually all the football teams in Spain all use it. But it works on the autonomic nervous system. So the autonomic nervous system is something that we all have. It's the autonomic nervous system is responsible for everything that we don't think about. So your pulse rate, your blood pressure, your bladder contracting, your bowels working, everything, your immune system, all of that sort of stuff. But it's the stuff you don't even know. It just happens in the background and you don't even know about it. But there's two aspects. You've got your sympathetic, which is your fight and flight. So that's the adrenaline and the cortisol responses. It's when you need to run away from a dinosaur and things like that. Your heart rate goes up, your blood pressure goes up. But it's that typical, oh my God, crazy, busy, stressed sort of feeling. And then you've got your parasympathetic, which is your rest and repair and rest and digest, which just lets everything work nicely. And unfortunately, you know what I'm going to say, our sympathetic is bonkers and crazy and ridiculous and causing us problems in terms of stress, not sleeping, immune problems, maybe cancer, all of those sorts of things. Whereas our parasympathetic is pretty useless because it just doesn't get any downtime. See, so basically this machine, you sit there for an hour with gloves and socks on, and it just runs the electrical current through the body, and it just recalibrates your autonomic nervous system.
Oh, wow.
It's fascinating, and we've seen some incredible responses. You know me, I'm all about the science. There needs to be good science behind what we're doing, which I believe there is, but actually seeing patients benefit from it, seeing a lady with an overactive bladder who's up 6 times at night, who is knackered and not coping because she's so tired. She came in and she's only getting up twice at night now and looks phenomenal. You just come in, she said, yeah, I hoovered all my house, I did this, I did that. So things like that you'll never be able to access that on the NHS because there's no funding for it, but it doesn't exist in the NHS. But something like that you're not going to get any side effects from it. It's probably going to work because we've all got autonomic nervous system dysregulation in some way, shape, or form. It's just amazing. It's just so lovely to be in a position where I can offer this to patients.
Wow. That sounds
Yeah,
interesting. I want to go with that.
yeah. When you come back, you're on it. You're on it. In fact, we'll get everyone on it. Your whole family. It's brilliant. I must admit, I've been taking it home occasionally, but going on it myself.
But going back to what you're saying, though, you're still an NHS GP, but on top of that, now you've also got a private clinic. So where
Yeah.
does the time come from for you to say, hang on, there's a bit of me time? Because it seems like you've doubled your workload now. Are you?
Yeah.
You take part in all of the therapies, the classes that's going on in your own?
Oh, I would love to. That would be really sensible, wouldn't it? But as a doctor, it's do as I say, not as I do, sadly, at the moment. But yeah, no, do you know what? Yes. So as I said to you, I take this machine home. So I do some stuff at home. I do go to the Pilates classes. We do sometimes. I will be accessing reflexology at some point. But yeah, it's hard to find the time to do everything, really, isn't it? But I think one of my best friends who's a GP up in Scotland, she said to me, okay, so you're an NHS GP almost full time. You're doing, I just need to tell you, Darren. So I'm doing a diploma in lifestyle medicine. I'm doing a diploma in this NESA machine that we're doing. And I'm also doing a master's qualification in menopause. So, yeah, my best friend said to me, she said, "Do you think you might be taking a little bit too much on for the time being?" I was like, "No, it'll be fine. It'll be fine." And she was totally right. It's way too much. And I'm literally, when you feel like I don't know, I feel like sometimes I'm spread so thin that I'm not really doing anything particularly well. But I think it's so the Vale Wellness is now 2.5 years in. Oh my gosh, we're in an entirely different situation now to where we were 2.5 years ago. So I think sometimes it's really nice to take stock. We don't often do it because we're so busy trying to develop the practice, push forward, but just to take stock and see actually how far we've come. And we're talking on a Friday at the moment, and I was just saying to you that I've been baking cakes this morning for our restaurant. I've also been out for a really beautiful, I didn't go that far, 7K run in the sunshine, listening to Metallica. So, it.
Really better than that.
You can't get better than that.
Then
So
West
that
Wales, yeah.
in West Wales, yeah, yep, down in Saundersfoot.
Perfect.
So yeah, so it's
Yeah.
lovely. So I think, yeah, I do need to practice what I preach. You're absolutely right, and I do try and do that. But I think that gives me a better understanding actually of how difficult it is to do all of these things which we know are going to make us better. But yeah, I do try and do a bit of meditation. I try and do a bit of breath work. I try and do all of that stuff because I do know how beneficial it is. And I think actually if you look after yourself, so good nutrition, exercising regularly, bit of mindfulness and breath work, if you do all of those things, you actually function better as a human. So you function better in that you can work harder, you sleep better. I think you think, "Oh, I've not got time to do it," but actually doing those things makes you time because you're more productive and everything works better. So,
Yeah, and I guess obviously being an NHS GP,
mm,
it's got its own rewards. You're
yeah,
helping people,
mm,
very sick people sometimes.
yeah,
But then I think going then towards your clinic and it's your own business, it's something you've started from scratch.
yeah.
I imagine that's very rewarding as well, isn't it?
Yeah, it is really rewarding. I did totally underestimate how much time and how much money it would take to set it up. I know nobody makes any money out of a business for the first few years, do they? But it's just the time. It's the time that it's been taking. But every single day I was telling you about the sorry I was halfway through telling you about the lady who was having the migraines and all of that. Yeah, and she's ended up on this NESA machine and she's doing really brilliantly, but she's actually applied for a couple of new jobs since she's been seeing us, and she's got a couple of new jobs, and she's now an advisor for I don't know, some council or government or something, I don't quite know, but just making that difference. This
Yeah.
lovely lady has changed her life with our help. And I don't know, there's something that when you do medical school, Darren, when you go in for your interview, everyone says to you, "Oh, don't say that you want to look after people because no one will give you a place in medical school to do that. You've got to make up all this nonsense about how you really like science and biology and you want to be part of a greater good or whatever, all of this stuff in terms of your interview. All I want to do is look after people. It's just in my psyche, it's in my nature. That's the reason I went to medical school, and doing it in my private clinic, I can just do it in a better way."
How do you see the future now? Because obviously, from the COVID era to now,
Mm.
your life has changed quite dramatically. Do you look quite far into the future, the near future? Would I be right in saying you'd want the clinic to be looking after itself a bit more and a bit less sort of inclusion of
Yeah.
yourself? Or would you prefer, or are you still looking to expand even further on the services you provide?
Yeah, absolutely. The thing with medicine is it's so fluid. There is always something new. And even just to stand still in medicine, you're constantly reading new papers, listening to new research. I do a lot of my medical education via podcasts, which are brilliant. Medical podcasts these days are fantastic. When I'm out running, if I'm not listening to Metallica or Nirvana, I can get a podcast on. But yeah, I think particularly with my clinic, because it is mine and I'm able to take it in whichever path I want. I think it's just a matter of looking at the new sort of techniques and services and medical devices and other sort of treatment options that there are available and out there. And I think what I am able to do, because It's my place, and I have sole creative input into what goes in there, along with Jo, obviously, giving us her advice and her expert counsel. I think I've really enjoyed being able to go down the holistic path, because I know I think we've lost a lot of knowledge, sadly. I think back 100 years ago, all these people that were chewing on willow bark for pain relief, and they were giving acupuncture as anesthesia, all of these sorts of things. I think things have changed, haven't they, in Western medicine, and we've almost gone, oh, that's a load of nonsense. Let's just shove everyone on drugs and do this. And actually, I think things need to go back a few steps. And I think when you actually do look at those sorts of techniques, the acupuncture, particularly massage, reflexology, Reiki, maybe naturopathic medicine. I've got a lady joining the clinic who is a herbalist. And she's done extensive courses. She's really well qualified, knows a lot about herbal medicine. I think a lot of people are wanting to go back to that. I think they're fed up with big pharma saying, you must take this drug, you must take a statin, you must take aspirin, you've got to do this. When actually, we've all got the power within ourselves to be able to change our lifestyles. And do you know, I say to people that it makes me laugh that I'm going to say to you now, Darren, I can tell you a couple of things. I can give you a treatment that I can guarantee will make you feel amazing. It's going to reduce your risk of heart attacks, strokes, cancer, dementia. It's going to improve your mental health. It's going to make you feel so good, and it's not going to give you any side effects at all. And what would you say to that? Would you be like, oh my God, yes, please? Yeah.
Yeah,
It's just changing your lifestyle. It is
yeah,
literally exercising, meditating, getting your sleep right, and getting good nutrition. It's not difficult, but we've lost that, I think, and I think it's really sad that we have. And
yeah.
I think we need to get it back.
I think people's lives have become so busy, and
Yeah,
with whether it's work or whatever they're trying to cram in between work, or whether it's family time.
yeah,
A lot of people are carers now as well, and I think
yes,
that's a lot of mentally and physically exhausting as well. And it's so easy to forget
yeah,
in it all,
yeah,
isn't it? And it's so easy to get lost. But I think like you're doing, and like you're saying, I think you need to allocate time regardless. No
yeah.
matter what's going on in your life, you've got to give yourself some time. Yeah,
Absolutely. And I think it makes you a healthier person in every way, physically and mentally. And I think by doing that, actually, it does make you more productive. It makes you a better parent. If you're not stressed, if you're not literally pulling your hair out because you've been able to have that 15 minutes of doing a bit of yoga in the morning, that's beneficial for everyone, isn't it? And don't get me wrong, I do appreciate that life is really hard for a lot of people. And a lot of us are very lucky in what we have and the time and the facilities that we can access. But there are ways that you can do all this. Just going for a walk, going for a 10-minute walk. Something like that is so easy. Trying to not have ultra processed rubbish and trying to make some healthy choices, which isn't going to happen every time. It should, but it won't. But for those people who are struggling either financially or struggling with being able to have the time to do those things, I think what I see my role and where I want to help is at least being able to educate people so they know what is good for them. Because I think at the moment, I'm really embarrassed to say this actually, Darren, being a doctor of however many years, but I remember up until about maybe 4 years ago, 5 years ago, yeah, before the cancer, not really thinking about what's put in our food. So, not really thinking much about the preservatives, the additives, the stabilizers, the emulsifiers, all of those sorts of things. And then I read a brilliant book, which I don't know whether you've read, but it's the, oh God, Chris Van Tulleken book, The Ultra Processed Humans, is it called, or something like that? Oh, amazing. You need to read it. And actually, if we can put it in the notes at the end of this, I would literally recommend it to absolutely everybody. But it just got me thinking. And then I thought, blinking heck, we're actually putting all of this stuff in our body, which is it's wiping out our gut microbiome. It's causing horrendous inflammation within our bodies. It's ruining our metabolic health, all of those things that give us heart attacks, strokes, cancers, those sorts of things. And we look at the health figures and we see the fact that more people are having strokes and heart attacks than ever before. More people are diabetic, more people are obese, more people are experiencing cancer than ever before. And you think, what is it that it's not as if the air is changing because of pollution, but what is it that's changing? And I really strongly feel that it's a lot to do with what we're putting into our guts.
Yeah.
And you look at all of those chemicals, and it really upsets me actually that the government aren't doing anything about. I don't know anything about politics. I could never be a politician. It's a thankless task. And I really don't know the details. But what I do know is medicine. And I know a lot about gut health and about metabolic health and microbiome and lifestyle. And what I do know is that if you are putting in a load of ultra processed crap, you are going to increase your risk of all sorts of diseases, and you're going to feel pretty shocking. But I had an epiphany where I just thought, oh my God, yes, we're doing all of this. And it is making it's causing massive problems for our individual health, but also health as a society. And of course, all that entails people not being able to work because they're poorly, people having to take benefits from the state because they're unable to work because they've had illness. It's huge. It's huge.
Yeah, absolutely. Yeah. And it goes hand in hand with exercise, isn't it? So
It
if you're
does.
exercising, why would you want to
Yeah,
put all that ultra processed food in your body to
absolutely.
just counteract all of the good work you're
Yeah,
doing?
yeah,
Um,
yeah. You're
I
absolutely
know
right.
I've read countless self-help books, that sort of thing. I think one that's quite applicable here is Atomic Habits, in that it's important to identify what the problem is, which is, I think that's the biggest challenge for most people,
Yeah,
in thinking I'm doing far too much, I'm not looking after myself, I need to change what I'm doing. I think once you've made that decision, then I think it's, you don't look at it as a big mountain and think you've got to change everything all at once. Start
yes,
making small changes often, and then make those little changes become habits. So you're cooking
yeah,
fresh for a few weeks, and you're getting into that. That's great. Okay, I'm going to start doing quite a bit of walking now, and then and just
yeah,
quietly weave it into your life, and then
yeah.
those small changes will slowly build up into something much bigger, I think.
Yeah, you are so right. And that's what it's all about, isn't it? It's just making the small changes which are entirely manageable. And then all of a sudden, 6 months down the line, you've made 5 or 6 small changes. And actually, they're so impactful on your life. But they've become habits, as you say, they've ingrained. You do that walk now. You do walk up the 4 flights of stairs to get to work. You do, I don't know, cook from scratch, as you say. Just all of these, they're small things, but you just need to do one step at a time. It's like anything in life, isn't it? You wouldn't go and run a marathon without doing a bit of training first, would you? Some people might, but you wouldn't if you were normal.
That's brilliant. Thank you so much for joining us today, Dr. Alison. It's
My
been amazing.
pleasure.
Such an inspiration talking to you. I think it's me, like I said at the beginning, a lot of people are going to resonate with your story, and I think it's just totally inspiring. Thank you so much for joining us. Good
Oh,
luck
thank you,
with the
Darren.
baking.
Thank you
And
very much. Actually, after you've said all of that, I'm going to go make a chocolate fudge cake. So,
wow.
as I said, I know, don't
Yeah, but
eat
at
it.
least you
It's
know what's
really
going
bad.
into it.
I was going to say, it's all healthy ingredients.
Yeah,
Lovely to speak to you. Thank you so much for having me on. And
and
I
you
look forward to seeing you soon and give my love to everybody.
will do. Thank you.
Thanks, Darren.
And that's a wrap on today's episode of Island Life Stories. A huge thank you to Dr Anne Alison for being so open, honest and genuinely inspiring. If her story has made you stop and think, even just for a moment, about how you're looking after yourself, then I think she'd say that's exactly the point. Anne's message is such an important one. It's not about big dramatic changes overnight. It's all about small, consistent steps. A walk here, a better night's sleep there, swapping the ultra-processed stuff for something a bit more real, little things that, over time, add up to a completely different life. You can find all the details for Dr Anne Alison and Vale Wellness in the show notes, including how to get in touch, where the clinic is based, and the book she recommended, Ultra Processed People by Chris Van Tulliken. Genuinely worth a read. If you've enjoyed today's episode, please do take a moment to like and subscribe, whether you're listening on Spotify, Apple Podcasts, or watching us on YouTube. It honestly makes such a huge difference and helps more people find the show. And come and join the conversation over on social media. You can follow Island Life Stories both on Facebook and Instagram. I'd love to hear what you've thought of today's episode and who you'd like to see on the podcast next. Until next time, take care of yourselves, and I'll see you on the next one.